House Bill 374. Delegate White Holland.
Thank you, Mr. Chair, and good afternoon, everyone. I wanted to alert the subcommittee that we are still working and engaging key stakeholders related to this bill. The respective boards, the acupuncture board, as well as the Board of Massage Therapists, are meeting and reviewing the amendments that were offered during the hearing last week. And so in the process of reviewing those for their consideration, and expect to have, I would say, be prepared for more of a robust discussion next week. And so recommending that we hold this bill for now to allow for those discussions to continue in order for us to make sure that we are able to vet and ensure that the amendments are able to address some of the concerns that were raised by those that oppose the bill. But those are the highlights of where we stand right now. But we are in the process of working everything out with all parties. Thank you, Mr. Chair.
Well, we like to hear the news that people are trying to work things out and bring a solution, a compromise to us. So we will continue to we will hold House Bill 374. Let's then go to House Bill 373, State Board of Dental Examiners, Disciplinary Action and Unannounced Inspections. Delegate Kipke.
Thank you, Mr. Chairman. The bill is supported by all entities except for one individual who represents Heartland Dental. I don't know if she's on the call. I thoroughly reviewed the objections, and I communicated through their lobbyist for some communication, and have not received any since the hearing. But I'm happy to respond if there are any additional concerns.
Council, do you wish to summarize the bill for the committee, please?
Sure. This is the bill that authorizes the State Board of Dental Examiners to conduct an unannounced inspection to determine compliance with the CDC guidelines on standard rather than universal precautions and guidelines for infection control in dental healthcare settings under specified circumstances. The bill updates and alters grounds for disciplinary action by the board and authorizes the board to take disciplinary action against or relating to an expanded function dental assistant.
Is there any discussion of the bill, further discussion of the bill? Is there a motion from anyone, the sponsor or anyone else?
I'm not on the subcommittee, so I don't know if that's...
Move favorable.
Okay.
Second.
Moved and seconded. Is there any discussion or debate regarding House Bill 373?
Todavía está frío.
Seeing none, is there a motion on the bill?
Move the bill.
Moved, and is there a second?
Second.
Okay, moved and seconded. Any debate on the bill? Hearing none, all those in favor, please raise your hand. Please raise your hand virtually. Torres. Delegate Lopez, you're here as a guest. Oh, you got your real hand. Sorry, I was looking for the yellow thing. Van Holland. There appears to be a majority. Do you agree, Council?
Yes, I do. We have two members that are absent. I think they are still in the Public Health Subcommittee meeting, but
okay, an excused absence. Okay, there is a unanimous favorable on 373. 377 is held from last week.
Delegate Rosenberg, I'm so sorry to interrupt. I just want to make sure that the group can see me. This is Danielle Varanian. I'm the opposition to 373. I don't know if you wanted me to articulate what the opposition was.
Well, I'm tempted to say you had your opportunity to speak, but I'll give it to you briefly.
Oh, okay. I just want to make sure that the group understands that the entirety of the bill isn't what we are opposed to. There's two specific sections of the bill that we are opposed to. One is the expansion of the unannounced inspections under a second publication. And the second is the inconsistency with respect to how the board is treating expanded function dental assistants and the responsibility of the dentist for their certification. It's inconsistent with the section above it under section 38. I'll just say what I said in the main hearing. We have some significant concerns about expanding this board's authority when they are not doing their job in any other arena. I had a client who reported a sexual assault. It's been 6 years. They have never investigated that situation. But to be clear, on page 3 of the bill, where it talks about the disciplinary section for the expanded function dental assistants, we do not object to that language. And I apologize, I didn't think you could hear me earlier.
Okay, now Delegate Kipke, you said you hadn't heard back anything. You sought out, well, restate your interactions, please, with.
Yeah, I
people.
just let the lobbyists know that I reviewed the concerns raised, and I'm having a hard time agreeing with the concerns, and was open to a conversation about it. So that was the interaction.
And my apologies, Delegate Kipke, we can get back to you about your concerns.
Well, what is the votes are there to pass the bill, but even though.
If you want me to respond, so in regards to, they already have the authority to do unannounced inspections. That's existing law. It's in response to a complaint, by the way. I think the objection is it's expanding it to a new publication with the CDC that it relates to infectious disease control. And, that's something that I agree with. So, it's not a wild expansion. It's, I think, an expansion that most people would say is consistent with the duty of the board. The other, I don't exactly understand the other objection about inconsistent, but if it's related to making sure the dentist knows that the advanced practice dental assistant is licensed, I think they should do that. Perhaps I'm misunderstanding the concern, but just as they would have to make sure a dental assistant or a dental hygienist or another dentist working in the practice is licensed, I think that's an appropriate responsibility of the dentist who owns the practice.
So do you think further conversations would be helpful?
Between now and when the bill is voted on in committee, I'm certainly open to having a conversation.
Okay, so then we would move forward with a favorable, with the understanding that the sponsor of the bill will be meeting with the opponents of the bill and may have an amendment to offer prior to or by the time of Friday's voting session.
Yes, sir.
Okay, we appreciate your willingness to do that. And Ms. Varanian, please be more responsive than as Delegate Kipke has said you have been thus far.
No problem. Thank you.
Okay, thank you. So we will move, the bill will get a favorable with the understanding that there will be further discussions between the sponsor and the lobbyist. Thank you. Okay, let's move on to the last bill on the list. And then
We've
we'll
actually
come
got
back.
2 more.
Right, come back to 377. 422 Public Health Expedited Partner Therapy Bacterial Vaginosis. Delegate Bagnall is the sponsor. And council, there are 2 sponsor amendments. What does the bill do and what would the amendments do?
So the bill adds bacterial vaginosis to the list of conditions for which antibiotic therapy can be provided to an individual under the state's Expedited Partner Therapy Program. That program is the practice of providing antibiotic therapy to the sexual partner of a patient that's diagnosed with certain sexually transmitted infections without an intervening medical evaluation the idea is to stop the further spread of the infection and reduce the likelihood of a reinfection of the partner of the patient that has been seen by the practitioner. So the sponsor has offered 2 amendments. I put them together into one reprint so that you could see them in the same bill. The amendments alter the short title and update terminology in the bill and add licensed certified midwives to the list of health practitioners who may provide antibiotic therapy under the expedited therapy program.
And is there any opposition to the amendments that you are aware of?
Not that I'm aware of.
Not that you're aware of. Does anyone online at the moment have any concerns about the bill or the amendments? There was no opposition at the hearing. Delegate Saliga, I'm sorry, I didn't see your.
I
yellow
just put
hand.
my hand up. Thank you.
Okay.
I had a concern in the hearing about over prescribing antibiotics, and there's a concern in the medical community about that. But I think the amendments make it better. On page 2, it says that they can dispense or provide antibiotic therapy to a sexual partner instead of any. So I think that's a good, rather than, because my question was, what if they have multiple sexual partners? How many, antibiotic prescriptions are you going to send out? Which would, again, I would have concerns about, not the bill, but over prescribing antibiotics. So I just thought I would raise that point. Thank you.
So you are okay with the bill, even more so with the amendments?
Yes, exactly.
Fine.
Thank you.
Good. There being no further discussion, all those in favor of the bill, well, no, first we have to adopt the amendment, I guess.
Move the amendments, Mr. Chair.
Second.
And seconded, all those in favor of the amendment, please say aye.
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 Anyone opposed? No one is opposed. The amendment is adopted. Is there a motion on the bill as amended?
Move the bill as amended.
So
Second.
moved and seconded. All those in favor of the bill moved or amendment, please raise your anatomical right hand or your yellow right hand. We have a majority unanimous. Okay. Fourth and final bill, third on your list, 377 physician assistants. Can you summarize where we stood when we last met, council?
So this is the bill that authorizes a physician assistant to perform numerous additional duties, requires health maintenance organization quality of care standards include a requirement that each HMO member has an opportunity to select a PA as a primary care provider from among those available to the HMO, adds a PA member to the statewide advisory commission on immunizations, and excludes a PA from the definition of healthcare practitioner with respect to healthcare staffing agencies. Last week, you all adopted amendments from the sponsor to update the list of providers that can admit a pregnant incarcerated individual to an infirmary, to clarify that that list is a nurse practitioner, certified nurse midwife, licensed certified midwife, PA, or a physician, and then also update the list for the ability of a member of an HMO to select their primary care provider to provide for a certified nurse midwife and licensed certified midwife. Last week, where we held off this bill, you were discussing some amendments that were offered from MedChi, which I can go through again if you'd like. And I understand the sponsor has another amendment for you all to consider that has not been circulated, but he is here.
Okay. I think we should matter protocol here from this sponsor first and then from Mr. Wise on behalf of MedChi.
Thank you,
Delegate
Mr.
Johnson.
Chair. After working with the stakeholders.
Oh, excuse me, Delegate Riley, is your hand up or are you still voting? Okay, thank you. Sorry, Delegate Johnson, Steve.
All right, thank you, Mr. Chair. After working with the stakeholders, we've come to a consensus that we just put in an amendment to take out the involuntary admission part of the bill. And
Mhm.
with that, I do believe MedCai is okay with the rest of the bill.
Mr. Wise, you've been mentioned.
Thank you, Mr. Chair, and thank you, Delegate Johnson. Yes, with that amendment, taking involuntary admission out, we drop our other requested amendments and would be fine with the bill.
Okay. So then is there Robin Elliott? You have the floor.
Hello. Robin Elliott on behalf of the PAs. Just wanted to, we understand the committee needs to move forward and are supportive of that. Just wanted to lift up that the provision about involuntary commitment really has to do with decreasing the wait times for patients. And so just wanted to sort of put an asterisk next to that for something that could be considered in the future.
Okay. Mr. Altieri?
Good afternoon, Mr. Chair. Thank you so much. I'm Gabe Auteri with Harris Jones Malone on behalf of the Maryland Psychiatric Society. And we have a few of our members here, and I'll introduce them in a moment. But I just wanted to say, obviously I appreciate the policy perspective of allowing folks to practice at the top of their license in a medical setting. I think there are several sections in this bill that add PAs to physicians and nurse practitioners in certain contexts and allow them to do certain things. But then there are other sections that, in addition to physicians and nurse practitioners, talk about psychiatrists, talk about licensed clinical social workers or other licensed mental health providers. And I think we, Maryland MPS, have some concerns not only with regard to involuntary admission, but also in those sections of the law where psychiatrists and licensed mental health providers are specifically enumerated, that there are important mental health considerations that we should be aware of and be clear of. And so with us today from the Psychiatric Society, we've got Dr. Lewis, Dr. Hansen, and Dr. Young, and we're happy to speak more about it or speak with Delegate Johnson offline.
But you support the bill as amended, as does MedCai?
I think that we support the amendment. I think that in an ideal scenario, there would be further amendments in the context where PAs are added to a list that includes psychiatrists, LCSWs, and other licensed mental health providers.
Okay, but you're not offering such an amendment, or are you, verbally?
We would be happy to. Dr. Hansen, I wonder if you would like to weigh in.
Sure, I can do that. We have not yet seen the amendment proposed by MedCai. We would like to take a look at that. In addition to the involuntary certificate, there was also a provision that would allow them to file for emergency petitions, and that was a part that we had concerns about. I'd also like to explain the concern about signing the certs is it's actually a problem with the form that MDH uses in their involuntary admission process. Our law was changed in 2021 to allow LCPCs and LCSWs to sign certificates, but the MDH has not revised its form to include those specialties. So some people in the emergency room may be under the mistaken impression that these other professionals in the ED can't sign the forms when that's not really the case. And so we do support the MedCai amendment to exclude them from signing civil certificates. We also want to make sure that the emergency petition portion is also included in that.
Anyone else? Dr. Young?
I agree with what Dr. Hansen was saying. I think she laid it out well. I think that just the point to just emphasize and just to reiterate, because it is very confusing, is there are types of clinicians that are already in the ERs, LCSWs specifically and LCPCs that can sign these certificates, but most people don't know that because it's not listed on the form as one of the types of clinicians. So if that form gets updated, I think it would be a lot easier. And the other thing is, generally, in looking at the data of who signs certificates in the ERs, is generally physicians,
And occasionally it might be a nurse practitioner, but there are also these other clinicians that could do it as well. So really getting someone to sign the certs shouldn't be any kind of delay. It's more of an issue of whether there's a bed to admit to, but the signing the cert should be something that could be easily accomplished.
Ms. Williams?
Yes,
Mr.
thank
Williams?
you. Yes, thank you, Delegate Rosenberg. This is Krista Williams on behalf of the Maryland Office of the Public Defender, standing in for my colleague Sanjeev Varghese, who is Deputy Chief of the Mental Health Division. And I just want to say I do second, what Dr. Hanson and Mr. Young or Dr. Young just mentioned as well. So we do support the amendment removing involuntary admissions from this bill. And we also, I have not yet seen the amendment, but I understand there's been quite some conversations and discussions around that. And so we would also just highlight a concern about emergency petitions as well. If that's not included, that should be included as being removed from the bill for those reasons previously stated. I will also highlight that my colleague, Mr. Varghese, sent over an email to members of the committee and subcommittee that outlined times and waits throughout emergency rooms in terms of certificates being signed, which our experience is showing that there is no delay in that particular process. But as Dr. Young just mentioned, that really the delay is around the beds. And so I'm just glad that was highlighted. And so I would reiterate that point as an area that certainly does need to be addressed. But if there's any additional questions, I'm happy to answer. Thank you.
Robin Elliott, your hand is still raised.
Just to provide some background information, I think that there is actually extensive data. I know that the committee is likely taking involuntary admissions out of the bill, but just to let you know that there is extensive hospital data that shows there are delays, particularly in community hospitals, in which there is one physician and PAs working. They don't have the social worker or the LCPC. I think some of the other discussion, just to clarify, was primarily about voluntary admissions and emergency petitions, and just wanted to highlight for the committee that the bill is being supported by a diverse range of behavioral health groups. So we have both NAMI and the Baltimore Behavioral Health System. They don't always agree on behavioral health issues, so that's very notable. And on the emergency petition piece, one of the reasons that that is important is so that PAs do not have to turn to calling peace officers on the emergency petition, and they can keep the process within the healthcare, which is much less traumatic for the individual involved. So just wanted to provide that background.
Okay. I'm going to ask, especially since we're talking here about practitioners of the talking cure, that you have further conversations with Mr. Wise and with the bill sponsor and whoever else wants to be included, with the goal of trying to reach consensus by early morning, before we go on the floor on Thursday, so that this can be on the voting list for Friday. So that wouldn't be any delay to the bill, because we won't be voting as a full committee until Friday. But the chair is going to hold the bill, but asking all of the parties to get together and hopefully reach an agreement that you can communicate to us by Thursday morning. Okay, I believe that concludes the business before the subcommittee. When is the full committee meeting? Lindsay, do you know that?
2 p.m. for bill hearings.
Okay, fine. We are adjourned until 2 o'clock. Or we stand adjourned. We'll see you all at